I think because myeloma is incurable, because at least, according to most people at this Congress, I'm hoping for a day when it's indeed considered curable. And because patients live with myeloma for years and years and have, some studies have shown that patients living with myeloma have the worst quality of life compared to patients with any type of blood or solid malignancy. I think it's really important for us to discover other ways to really work on quality of life, emotional distress, and just about anything in that domain. A lot of times, a lot of our supportive care interventions are very siloed, either within the hospital or a very in-person intensive, meeting with a therapist either by Zoom or in person. What I like about this, coaching concept is it's really done at the cadence and the pace and the methods that the patient prefers. We've done a pilot study of this curriculum actually during transplantation, and it's really interesting, not surprising, but interesting to see some patients love talking to their coaches by phone, some prefer just texting back and forth, some use email, and so the versatility of this digital curriculum I really like. There are kind of two ways to approach it, or two maybe backgrounds that coaches can have. This particular study and some of the other studies that I've run, these coaches are not themselves patients, nor are they doctors or nurses or healthcare professionals, but they are certified life coaches. So they're trained to help all of us, just people with issues that we're facing. I'm really proud to see that HealthTree, so Myeloma Crowd, has launched a similar coaching curriculum, but this is actually for patients by patients. So patients can sign up to be coaches for patients who are newly diagnosed, navigating transplant, navigating therapy. Is there one right answer? No. I actually hope that both strategies kind of succeed, because I feel like for each patient, some may benefit more from someone who's had myeloma, been in their shoes. Some might benefit from a kind of a trained, certified coach who's been coaching all types of patients with cancer for a while. So some variability there, and I think with most interventions in oncology, we try to focus on keeping everything as consistent and scalable as possible. But I think with this type of an intervention, there's no one right answer or one right pathway. So I'm glad that there's a couple different options out there, again, for patients to handle their emotional distress, their anxiety, depression, really any of those things, and most importantly, improve their quality of life.